today we're going to talk on postural variations of a nutcracker. All right, so let's start. So if you think about the sleeping posture, it's so variable, but basically we can categorize them into 4 categories like this: supine and lateral, left and right lateral, and prone. And some surveys says that this right or left lateral sleeping posture is about around the 60 to 70% of people have this sleeping habit, and 20-30% have this supine sleeping habit, and 5 to 10% this prone habit. And one important thing is a nutcracker phenomenon is a very dynamic phenomenon, variable with these postural changes, and Doppler ultrasound is very nice modality to see the variations, this phenomenon according to these postural changes. And so in supine posture, this is superior mesenteric artery is connecting the bowel, and because of the weight of the bowel in supine posture, it close to the abdominal aorta, and the compression of the left renal vein is most severe in the supine posture. And in this left lateral decubitus posture, and this superior mesenteric artery moves to the left side because of the bowel weight, and this space between aorta and superior mesenteric artery becomes wider, and the compression is quite relieved. In contrast, in the right lateral decubitus posture, because there is a large liver on the right side, and the superior mesenteric artery moves the less than left lateral decubitus, and so the right lateral decubitus is better than supine, but is not same as the left lateral decubitus. So the best one is the left lateral decubitus, and next is right lateral decubitus, and supine is worst. In prone position, we cannot evaluate Doppler ultrasound with this patient in prone position, but so we do not know, but I think it's almost the same as the supine posture. So remember, best one is the left lateral decubitus. And hi, Dr. Bao Kwan, you came.
Yes, yes. Sorry, I'm a little bit late.
Okay, we started. Just I introduced the supine left and right lateral decubitus difference of the superior mesenteric artery position. Let's see the cases. This is a young woman with Nutcracker syndrome, had a microscopic hematuria, proteinuria, and the left flank pain. Most typical 3 symptoms of Nutcracker. This patient had hematuria, proteinuria, and left flank pain. And in this supine posture, it has a very narrow space between these arteries, and the left renal vein is compressed here. And this is the color Doppler, and the compression here. And after compression is bright color jetting flow here, and peak flow velocity is very fast, 214. In left lateral decubitus posture, and the superior mesenteric artery moves to the left side, and this is aorta, this is supplementary artery, and the left renal vein is compression is quite relieved, and the peak velocity here is much lower than this in supine posture. It's now the 51.7. In a right lateral decubitus, and the supplementary artery moved to the right side, but because of the liver, it just moved to this location. And let's see. And now the still there is a compression, and the bright colored jetting is, we can see the bright colored jetting here, and the peak flow velocity is almost similar to the speeding of supine posture. So if we see this case, and the best posture is left lateral, and supine and right lateral is quite similar in this patient. And so we recommend this patient take this left lateral decubitus sleeping posture, and the left flank pain is quite improved fast, but the microhematuria and proteinuria is the change is very slow. And but the Doppler ultrasound with changing posture is a clear the material that we can explain the patient that you need to take a left lateral decubitus when you sleep. Another similar patient is the 60-year-old woman, microhematuria, and this patient has low abdominal pain. This hematuria is caused by the left renal vein hypertension itself, but this low abdominal pain usually is due to the development of the collateral vessels. In supine posture, is compression occurs here, and the color Doppler, sluggish flow here in the proximal left renal vein, and the fast flow here, and the velocity 137, and the left lateral decubitus SMA is here, and the compression is relieved, and we do not see bright colored jetting flow, and the velocity is around the 70, and the right lateral decubitus SMA is here, and we still have a sluggish flow in proximal left renal vein, and the bright color jetting flow here, and the velocity is between a supine and left lateral decubitus. So here, again, in this case, left lateral decubitus is best. Next is right lateral, and the worst is supine. Also, similar case, young woman, this patient has a proteinuria in supine, sorry. In supine, oops. In supine, as the bright colored flow here, 177 in the left decubitus, and 132, and the right decubitus in the 178. Also, the difference is not so big as compared to the previous cases, but still the left decubitus, left lateral is the best posture for this patient. Often we see cases like this. 44-year-old woman and had a left flank pain is a typical symptom of Nutcracker, and in supine posture is compression here, and it's a little bit sluggish flow, and we do not see the flow here in, and also it's quite difficult to measure the peak flow velocity. But like in this case, we just compare the color Doppler findings according to the postural changes. We can have an idea what will be the best posture. And the left lateral decubitus 45 degrees oblique posture, and the superior mesenteric artery is here, and the compression is a little bit relieved, and we see the better left renal vein flow here, and the left lateral decubitus 90 degree, and quite a smooth flow, along this left renal vein. Now superior ventral artery is here, quite moved to the left side, and the compression is relieved very much. And this is a right lateral 45-degree, and superior ventral artery is here. It's not moved far, and there's still compression here, and there's still the bright color jet flow here, and 90-degree right lateral decubitus. Still, the superior ventral artery is here, and compression is here. So if we compare this color Doppler ultrasound uh, in supine and left lateral and right lateral posture, we can see the difference of the superior ventral artery location and difference of the compression. 49-year woman, growth hematuria in this patient, and the supine, very sluggish flow here. And we do not see the prominent flow here in the left renal vein. And the left lateral 45 degrees, we can see the prominent flow here, and the superior ventral artery is here. And in 90 degrees and very smooth flow along this left renal vein. And if this kind of patient have a left lateral decubitus posture for several days, his gross hematuria usually stops. Another patient with gross hematuria is supine, and this blue colored signal is not from the left renal vein, it's from the left renal artery, and the left renal vein is here, and without the prominent color signal, there's a very sluggish flow here. And in this patient had a difficulty in having the left lateral decubitus because of the pain in his left shoulder, and even in very mild oblique postures, 30 degree, and the flow along the left renal vein is quite different from the flow in supine posture. So in this patient, just recommend not full lateral, but the oblique left lateral, and the cross hematuria is improved in this patient. This was a patient had the young man with left flank pain, pelvic pain, and had a urinary frequency, and they had a Nutcracker with peak flow velocity 118, and this is a color Doppler in the pelvic level transverse color Doppler. This is bladder, right side, left side. Vascularity is quite different from right and left. Prominent left pelvic congestion in this patient, and probably left pelvic pain and urinary frequency in this patient is probably due to this pelvic congestion due to Nutcracker phenomenon. And so this patient also asked to have a left lateral decubitus sleeping, and his symptoms improved. And we can see the difference of pelvic congestion according to the patient posture also. This patient had a prostate cancer surgery, and at 2 weeks after surgery, he had a right pelvic pain, and the urologic surgeon could not explain why this patient had a right pelvic pain after surgery, and asked me to do ultrasound, and I checked the left renal vein, and there was a Nutcracker phenomenon with a peak velocity 147, and color Doppler of the pelvis in supine posture had a pelvic congestion in his right side pelvis. And I think this right pelvic pain is probably related to the right pelvic congestion. And the question was right pelvic pain congestion occurred in this patient. We do not know exactly, but because of the cross communication of the right and left pelvic vessels in this patient, prominent congestion occurred in the right pelvis after prostate cancer surgery. And ask the patient to take a left lateral decluvitus, the best posture for Nutcracker. And the pelvic congestion is quite decreased because with this left lateral decluvitus posture, the flow through the left renal vein improves. That's why the pelvic congestion is decreased. And as this patient take left lateral decluvitus when sleeping, and his right pelvic pain was improved with this sleeping posture modification. It was very simple but nice guide for the patient to control that pelvic pain. Old man has microhematuria nocturia, and this patient has a recent weight loss for 10 kilogram weight loss for 2 years, and had a nutcracker 134 centimeter per second. And this patient is nocturia was quite severe, and the pelvic color Doppler shows a severe pelvic congestion as more on the right side. And with left lateral decluvitus posture, this pelvic congestion was quite decreased because of the improved flow through the left renal vein. Pelvic congestion flow is decreased. And with this right lateral decluvitus posture, I think that probably probably due to the gravity effect, this right pelvic congestion has occurred in this right lateral decluvitus posture. So again, this patient, the best sleeping posture should be a left lateral decluvitus. Patient with the severe nocturia, also this patient has nutcracker here in the left renal vein, peak flow velocity 119, and severe bilateral pelvic congestion in supine, and with left lateral decluvitus is only the right pelvic congestion is remained, and this is the right lateral decluvitus posture, and having some mild pelvic congestion bilaterally. But with this lateral posture, pelvic congestion is much less than that in supine posture. Okay, so I showed you the difference of the renal vein flow according to the patient posture, and also the difference of pelvic congestion, degree of pelvic congestion according to the patient posture. But in those patients with the pain or the other symptoms like gross hematuria or the flank pain or the bladder symptoms usually are improved quite fast after modification of sleeping posture. But this, like microscopic hematuria, proteinuria, this kind of the nutcracker symptoms does not improve fast. But if we follow long term, there is a definite improvement. Like this patient, a young woman with microhematuria and proteinuria, and had a nutcracker, definite nutcracker phenomenon with this is in supine posture 169, and the left 110 and the right 141, and recommend the left lateral decluvitus posture. And this is 4-year follow-up data of microhematuria and proteinuria. It's a very slow but progressive improvement both in microhematuria and proteinuria in this patient. Slow but definite improvement. Another important sign in this nutcracker phenomenon is fluctuating glomerular filtration rate. With the patient posture, this glomerular filtration rate is quite different in patients with Nutcracker phenomenon. This is a supine posture, and I had a Nutcracker phenomenon here, and the jetting flow here. Left lateral 45 degrees, flow improved 90 degrees, smooth flow here, and the right 45 degrees, so better than supine, but still jetting flow here, and right 90 degrees, also jetting flow here. And this patient glomerular filtration in multiple examinations quite variable, 50, 72, 42, 61, and best one was 82 after the sleeping posture modification. So quite big range between 50 and 82 is a fluctuating. So in this patient, if they had the continuous supine posture, probably glomerular filtration rate is around 50, and with the sleeping posture modification, it improves around 80. So quite a big fluctuation in this patient. This is the graph showing the GFR rise after modifying sleeping posture in 22 patients, and this data is around the, the 60, 60 or 70 here, and it improves slowly, but definitely in these 22 patients with the fluctuating glomerular filtration rate due to Nutcracker phenomenon. So I think that is for the last slide. So when I see the Nutcracker patients after ultrasound, I explain the patient about the Nutcracker and what will be the best sleeping posture, showing the Doppler findings according to the posture, and recommend the patient you need to have a lateral sleeping posture, and probably the easiest way is to have this like a long pillow and hug the long pillow and start the sleeping with left lateral decubitus. And if you take this sleeping posture long, probably you will have some discomfort on your left shoulder, and then you change it to the right lateral decubitus, and never go back to the supine sleeping posture. And usually this kind of guidance, the patients, most of the patients with Nutcracker syndrome had some improvement in their symptom like pain or bladder symptoms or the proteinuria or the glomerular filtration rate fluctuation. So that is all I talked about the postural variation